Another day, another story. Welcome back to our channel. Today, we have an important topic to discuss that affects millions of people worldwide. We'll be diving into the world of hemorrhoids, a condition that can cause a great deal of discomfort and pain. But the big question on everyone's mind is, can hemorrhoids actually kill you? Stick around as we explore the truth and also share some valuable tips on how to manage those painful symptoms. Let's get started. Before we delve into the details, let's first understand what hemorrhoids are. Hemorrhoids are swollen blood vessels that form in the rectum or anus. They can occur internally, inside the rectum, or externally, outside the anus. While they may cause discomfort, they are generally not life-threatening. However, there are cases where complications can arise. In extremely rare cases, hemorrhoids can become thrombosed, which means a blood clot forms within the swollen vein. This can lead to severe pain and require medical attention. Another potential complication is excessive bleeding, especially if the hemorrhoid becomes ulcerated or ruptures. Although it's uncommon, severe bleeding can lead to anemia if left untreated. It's important to note that while hemorrhoids themselves are not deadly, certain underlying conditions can increase the risk of complications. Conditions such as chronic constipation, obesity, and prolonged sitting or straining during bowel movements can aggravate hemorrhoids and make them more susceptible to complications. It's crucial to address these underlying factors to prevent further issues. Now that we've addressed the question of whether hemorrhoids can kill you, let's shift our focus to managing the painful symptoms. Here are some effective tips that can provide relief. 1. Maintain good hygiene. Keep the anal area clean and dry by gently washing with warm water after bowel movements. Avoid using rough toilet paper and opt for unscented, moistened wipes instead. 2. Apply cold compresses. To reduce swelling and soothe the affected area, apply a cold compress or an ice pack wrapped in a clean cloth for a few minutes several times a day. 3. Take warm baths. Sitting in a warm tub with a few inches of water, known as a sitz bath, can provide relief and promote healing. Aim for 10 to 15 minutes, a few times a day. 4. Use over-the-counter creams. Topical creams or ointments containing hydrocortisone or witch hazel can help alleviate itching and discomfort. Remember to follow the instructions and consult a healthcare professional if necessary. 5. Maintain a high-fiber diet. Including fiber-rich foods such as fruits, vegetables, and whole grains in your diet can help soften stools, making them easier to pass and reducing strain on the hemorrhoids. 6. Stay hydrated. Drinking an adequate amount of water throughout the day helps prevent constipation, which can worsen hemorrhoid symptoms. 7. Avoid prolonged sitting or standing. Take regular breaks and try not to put excessive pressure on the affected area. If your job requires prolonged sitting, consider using a cushion or standing up and moving around every hour. Remember, these tips can help alleviate the symptoms of hemorrhoids, but it's essential to consult with a healthcare professional for proper diagnosis and treatment. They can offer personalized advice based on your specific condition. To wrap up, hemorrhoids themselves are not life-threatening, but complications can arise in rare cases. By managing the painful symptoms and addressing underlying factors, you can reduce discomfort and prevent further complications. If you have any concerns or experience severe symptoms, please seek medical attention. Now, let's address some frequently asked questions about hemorrhoids. Can hemorrhoids go away on their own? Hemorrhoids can sometimes resolve on their own, especially if you make lifestyle changes like maintaining a high-fiber diet and good hygiene practices. However, if your symptoms persist or worsen, it's important to seek medical advice. Are there any non-surgical treatments available? Yes, there are non-surgical treatments for hemorrhoids, such as rubber band ligation, sclerotherapy, and infrared coagulation. These procedures aim to shrink or eliminate the hemorrhoids and can often be done on an outpatient basis. When should I see a doctor? You should see a doctor if you experience severe pain, excessive bleeding, or if your symptoms do not improve with home remedies. It's also important to seek medical attention if you have a history of hemorrhoids or if you notice any changes in bowel habits. Can I prevent hemorrhoids from occurring? While it's not always possible to prevent hemorrhoids entirely, there are measures you can take to reduce your risk. These include maintaining a healthy weight, exercising regularly, avoiding straining during bowel movements, and incorporating fiber-rich foods into your diet. And there you have it, folks. Hemorrhoids may not be life-threatening, but they can certainly cause discomfort and pain. Remember to take care of your overall health, address underlying factors, and follow the tips we shared today to manage those painful symptoms effectively. If you have any concerns, don't hesitate to reach out to a healthcare professional. Thanks for watching, and we'll see you in the next video. Thanks for watching.